Hello everyone. So before I begin, I want you all to look at this image. Actually, I want you to feel it. It is 6 a.m. freezing cold outside the beer hospital. You've been standing in the line for 2 hours, shoulder to shoulder, inches from a stranger coughing right in your face, just for that double number 142. For us, this might sound like a nightmare, right? But for thousands of Nepalis, this is just a normal Tuesday at every government hospital. This is the 6 a.m. reality that we call it. But wait, the real tragedy isn't just these waiting hours. The real tragedy is what happens after. So after that 2 hours of long marathon, you finally walk into your doctor. But now the real countdown begins. You have exactly 3 minutes. The doctor is already exhausted by previous 60 patients, and you are just number 142 again. You panic, you rush, and in that moment, you forgot the one thing that actually mattered. You are allergic to penicillin. You also forget the medication that you took last week. And once your time is over, you walk out. And then it hits you. You realize, but it's too late. You spend 2 hours waiting just to be unheard in 3 minutes. This trust breeds cognitive bias, and it forces our best doctor to guess instead of diagnose. And additionally, what about your medical history? It is not on any cloud server. It is right here in this plastic bag or Zola as we call it. This is the Nepal's electronic health record. Do the math, 3 minutes versus 5 years of crumple note. It is physically impossible to read, right? So valuable history is obviously ignored. This creates a deadly equation that is rush doctors plus hidden data gives diagnostic errors. So while most of the apps try to fix this by letting you book online, but a digital ticket does not just make the doctor less tired. It does not organize the Zola. So we asked ourselves, what if we could turn those 2 hours of passive idle waiting into active clinical work? Well, we found the answer. Introducing to you Mediwo. We don't just start on the line, we optimize the entire workflow. So, firstly, we eliminate the physical battle. With Mediwo, you book and pay from home for any government hospital and generate a live digital token. You know exactly when your turn is and estimated time of your turn. But even after all of this, you might still be wondering that you still need to wait for hours before your turn actually comes, right? So, while you wait, our system digitizes your chaotic history of medical reports, turning that Zola of papers into structured data with the help of OCR. Secondly, our smart AI system asks questions similar to what the doctor asks, like mini diagnosis and save this information. So by the time your number is called, you are now not just a token number anymore. You are a fully prepared medical case. Now watch what happens when patient 142 enter. The doctor does not just ask "Ke bhayo?" They already know. They see a two-paragraph summary, the summary of conversation he had with the AI model and another one of his long history of past records. By reading it, the doctor can skip the basics. He can obviously confirm some doubtful parts of the summary or ask more if he needs to. But with this simple process, avoids a lot of medical biases, right? And the probability of, oh, I forgot to tell that symptom. So we turned a 3 minute rush into 3 minute effective treatment by utilizing the waiting time period. Finally, we provide an efficient way for the doctors to generate reports instead of just writing one by providing smart autocomplete and template with the help of summary and reports, significantly optimizing the report generation process. And you also don't need to worry about your sensitive medical data as we are privacy by design and we follow the HIPAA guidelines for data encryption and deployment. So this is our team and team members. So finally, we believe that we cannot triple the number of doctors overnight, but we can triple their effectiveness. So join us in building Mediwo because your health deserves more than just a rush. Thank you.